Good afternoon. My name is Christy Wells, and I am the Policy Director here at Oral Health Kansas. Welcome to our third biweekly advocacy update during the 2020 legislative session. Today is February 14th. Happy Valentine's Day. Just a reminder that these calls are an opportunity to hear some legislative updates around issues that impact oral health in our state, as well as an opportunity to ask questions and some educational information around the legislative process as well. And another reminder that these calls are recorded and placed on our website at oralhealthkansas.org. I wanted to start today's call talking about where we're at in legislative session right now, just so you all have an idea of some of the upcoming deadlines and what we can look forward to in the next few months. So Kansas legislative session is a biennium, and so that means that it is 2 years. And so this biennium was 2019 to 2020, so we are actually in the second year of the biennium. That means that any bills that were introduced last year in the 2019 legislative session are still able to be worked on in the 2020 session. So if there are any bills that do not pass during the 2020 session, they are considered dead at the end of session, and that means that if anyone wants to work on those issues in the 2021 session, they will need to reintroduce the bill. The biennium really allows legislators to, and advocacy organizations to work on more bills throughout the 2 years. And so it allows them to really continue progress on bills that maybe didn't see progress they were hoping to see in the previous year. In Kansas, our legislative session runs from January to typically May, sometimes into June. This year, it started on January 13th, and we have had some recent deadlines in February. As you can see on the calendar posted on this slide, there are a lot of deadlines in February, especially this week, actually. So this week, we saw a lot of deadlines around bill introductions. So if someone wanted to introduce a bill, this is the final week that they can do that in the non-exempt committees, which I'll talk about in a second. And so we did see a lot of bill introductions this week, just on any topic across the board. So the next deadline is February 27th, and that is turnaround day. Turnaround day marks like the halfway point in session. And this year it's Thursday, February 27th. And turnaround day really means that bills need to be passed by one chamber if they're coming from a non-exempt committee, if they are to be considered throughout the remainder of the session. And so, for example, if we use the Medicaid expansion bill, which was Senate Bill 252, that bill was introduced and has had hearings in the Senate Public Health and Welfare Committee, which is a non-exempt committee. So Medicaid expansion has not passed out of that committee. If they want to continue working on the bill, they can do two things. One, it either needs to pass out of Senate Public Health and Welfare Committee and then pass out of the Senate by February 27th. Or two, it can be touched by an exempt committee. And so you can see the exempt committees on the slide. They include federal and state affairs of both the House and Senate. It includes Senate Ways and Means and House Appropriations, Senate Assessment and Taxation, House Taxation, and House Calendar and Printing. So what it means by touching those committees, it means that it would be referred to one of those exempt committees from Senate Public Health and Welfare. And so it would go to an exempt committee, such as maybe Senate Federal and State Affairs, and then it would get re-referred back to Senate Public Health and Welfare. And this is kind of a loophole that's created that they can continue working on the bill in Senate Public Health and Welfare if for some chance it doesn't get passed out of committee or out of Senate by February 27th. So this is kind of the first really big deadline for legislators that we see in the 2020 session. I won't necessarily get into some of the deadlines that we have later on, as I'll discuss those on future calls, but you can see all of the deadlines on this slide right here. Some state policy of interest that we are seeing right now. So Senate Bill 349 is the Kansas Oral Health Improvement Act. This is a bill that is being championed by Oral Health Kansas, and it would do really three big things to improve the oral health of Kansas. So it would increase reimbursement rates for dental providers. It would add some adult dental benefits for Medicaid beneficiaries, and it would establish a state oral health plan that would be regularly monitored and updated through stakeholder input. So that bill has been introduced in Senate Public Health and Welfare. We've been working hard to get a hearing in Senate Public Health and Welfare, and just due to political things, it hasn't really made the progress that we were hoping for. And so we have taken some of the components from that Oral Health Improvement Act and introduced some of them into the Kansas Department of Health and Environment budget testimony. We did testimony in front of the House Social Services Budget Committee yesterday, and just asked for some of those components, such as increased reimbursement rates, adult dental benefits, and funding to help implement and develop the state oral health plan. Senate Bill 252 is about Medicaid expansion. So that is the compromise bill between Senator Denning and Governor Kelly. And there have been weeks of hearings on this bill in Senate Public Health and Welfare. They've heard from proponents, neutral testimony, opponent testimony, as well as hearing from the Attorney General about kind of what's going on at the national level around the ACA and national policy that could impact Medicaid expansion in Kansas. They have scheduled a hearing next week for additional discussion and action on the Medicaid expansion bill. So we're looking forward to seeing what happens next week on that bill. Another state policy of interest is House Bill 2563. This bill supports enforcement of the new federal guideline to increase the tobacco age from 18 to 21. So it would increase the licensure fee for retailers from $25 to $100 every 2 years. And that money would really help go towards the Department of Revenue to help enforce that new age limit. And it would also remove the youth penalty. And finally, it would institute a flavor ban on electronic cigarettes only. And that flavor ban would exclude menthol. They had a hearing yesterday in House Federal and State Affairs, and majority of the testimony was in opposition to the menthol exemption in the flavor ban. We will see in the next couple of weeks kind of what happens around that bill. And finally, the Kansas Department of Health and Environment budget. There are hearings in the House Social Services Budget Committee and the Senate Ways and Means Subcommittee on Health around the Kansas Department of Health and Environment budget. As I said, we testified in support of getting some funding for oral health issues on the House side, and we will do Senate testimony next week when they hold their hearing. Thinking big picture about all of these issues, last week on Friday, the House voted on an abortion amendment to have a constitutional amendment to ban majority of abortions in Kansas on the August ballot, so that it would be up to the public to vote on that issue. It had previously passed the Senate and was just waiting for the ruling from the House. And the House had 80 votes in favor of passing that, but unfortunately they needed 84, and so it did not pass. And this has created some political tension in the Capitol right now. Senate President Susan Wagle has stopped a lot of work around Medicaid, a lot of bills that are focused on Medicaid from reaching the Senate floor. So that would include both Medicaid expansion and since the Kansas Oral Health Improvement Act does impact a lot of Medicaid issues, it would also impact that bill as well. And we have also seen her turn away some bills that had already been on to the Senate floor, have been sent back to committee just for some of those political reasons. So it's creating kind of an interesting feel at the Capitol. It's creating some barriers to getting some work done, but it does play into what's getting passed and what's happening. So like I said, over the past couple of weeks, we've heard hearings on Medicaid expansion, on SACO 21, have started hearings on the KDHE budget, along with other budgets as well. These are some hearings that will be next week that are of particular interest to Oral Health Kansas and just oral health of our state. So next week, there will be recommendations made on Monday from House Social Services Budget Committee on the KDHE budget. And then on Thursday, Senate Public Health and Welfare are going to have discussion and action on Senate Bill 252 around Medicaid expansion. Senate Ways and Means Subcommittee on Health will begin their hearing on the KDHE budget on Thursday as well. There are many other hearings going on, especially with turnaround day quickly approaching. These are just the ones that are of particular interest to Oral Health Kansas. I wanted to speak briefly just about the budget process in Kansas since we're starting to get into committee hearings around it. So in the fall, agencies submit their budgets to the governor about what they would like to see in the budget for their agencies. And then Governor Kelly looks at all of those recommendations and she develops her own recommendations called the GBR, or Governor's Budget Recommendations. In January, she presents these budget recommendations to the legislature, and each agency is referred to a specific committee. So for example, the KDHE budget is under House Social Services Budget Committee and Senate Ways and Means Subcommittee on Health. And so those subcommittees will hear an overview of the governor's recommendation. They will hear directly from the agency that the budget is focused on, such as the Kansas Department of Health and Environment, and they will hear public testimony. So they will take all of those into consideration and develop their own recommendation that they will then pass out of committee and send to the next level of committee, which would be the House Appropriations on the House side. So then the House Appropriations can discuss what they would like to see changed in the budget, or they can just decide to approve it as is. Once it passes out of House Appropriations, it goes to the floor. So for example, the House floor. And then once it goes through this process in both the House and the Senate, there will be a conference committee that is formed, and they will come to agreement on what they would like to see in the final budget. So for example, if the House Social Services Budget Committee wanted to see $3 million for increased reimbursement rates for dental providers, and then the Senate Ways and Means Subcommittee on Health wanted to see $5 million for increased reimbursement rates. In that conference committee, they would decide what exact amount of money they would like to see put towards this. So they could decide 3 million, they could decide 5 million, they could even come up with a new number they would like to see. And then after the conference committee finalizes and passes their recommendations, it goes back for a final vote on the House and the Senate floor. That is my presentation for today. Are there any questions about anything I've talked about today? You can unmute yourself, or you can put your question into the chat box. I'll pause just a moment longer to see if there are any questions. All right, I'm not seeing any questions, so hopefully I did a thorough enough job in my presentation that it was all easy to understand. If you ever think of some question that you would like to see in our next presentation, you can submit your questions through the SurveyMonkey link. It is surveymonkey.com/r/OHK question. And I will make sure to incorporate those into the next presentation. And of course, if, during the weeks, if you have any questions that you just want to ask directly to one of us, please feel free to contact myself at cwells@ohks.org, or you can contact Tanya at tdorf@ohks.org. All right, if there are no questions, we will go ahead and end the call for today. I appreciate you all being on today and hope this has been helpful. I hope you all have a wonderful weekend.